Hey doctors, I want to talk with you today about what to do when your schedule there's nothing to do, right? And this isn't so much for what you are supposed to do, but this is how to drive your team. So here's what I see today in a lot of offices. So I'll go in and there's a hole in the schedule for whatever reason. Maybe it was there from yesterday. Maybe you had a big cancellation, something like that. But there's this like 2 to 3 hour gaping hole in your schedule. I'll walk in the building and I'll look around and I'll see the front desk is kind of like sitting there looking busy, clicking around on the computer, not doing much. Back office is like sort of cleaning instruments, I guess. They're just trying to look busy. And the doctor is somewhere in the back. If there's a doctor's office or something like that, they're in the back and this is what they're doing, right? They're just on their cell phone like this, right? And I want to change that. So this is a technique that I've taught to doctors that has worked fantastic over the years for those that actually do this. You have to think about the mentality of the staff. When there's a big hole in the schedule and the doctor's in the back on his cell phone and the front desk then is just kind of like they're messing around or kind of clicking around the computer, and same thing with the back office. What do you think the staff thinks about what the doctor is thinking? They're probably thinking the doctor's actually happy because there's nobody on the schedule. Well, why would they think that? Well, because the doctor's sitting back in his office on his cell phone. I wish I was sitting in the back, sitting on my cell phone. He must be happy, right? Because I'd be happy if I was doing that. So he must be happy because he's doing that, right? This is what the staff is thinking. So they actually, in their subconscious mind, when there's a hole in the schedule, it's like a little mini vacation for everybody, including you, the doctor. Even though you might be like, dude, I'm not making money sitting here on my hands. This is boring as hell. I want to be busy. They think that you actually enjoy that time, right? So what I want to do is I want to flip that. Okay. And here's the way that we do it. When it's not busy, don't go and hide in the back office. You go right up to the front office and you stand there and you say, hey, I notice that I'm not busy for the next 3 hours. We got to get busy. I need you guys to pick up the phone and start making some phone calls. All right. Call some of the patients that came in last week that didn't say yes, or that came in 6 months ago and still have treatment on their treatment plan. I mean, there's tons of patients, millions of dollars in sitting in treatment plans of patients that aren't done. Start calling some of them, right? And the front desk really doesn't like doing that. They don't like picking up the phone and calling patients and asking them if they want to come in, right? So if you just say that, hey, why don't you guys go do that? And they'll go, okay, doc, that's great. And then you go and sit in your room. You know how many phone calls they'll make? 0 to 1, right? They might fake one. Oh, the patient didn't answer. Cool, doctor's back in his office. I'm done. That's the end. Let me create a list of the patients that I should be calling. I'm going to create that list over the next 3 hours and not actually make any phone calls. So what you need to do instead is you need to come up to the front and you need to stay in the front and watch the person making the phone calls. This is going to make them super uncomfortable, and that's what you want. You want them to be really, really, really uncomfortable. I mean, as a matter of fact, don't make it friendly and nice. Hey, you know what? We've got this 3 hour break. Why don't I go buy you girls some lunch, right? Because we have this 3 hour break. Terrible idea. Terrible idea. Because then they're like, great, can we have a 3 hour hole in this guy's schedule every day? And then he's going to go buy us lunch because obviously he's happy. We're happy. No, 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 no. I want you to sit in the front. I want you to tell them that you need to call and schedule some patients. And then I like, if it's my preference, I want you to have an angry face while you're literally sitting there watching them make phone calls. Don't be happy. I want them to know that you are very unhappy because there's this big hole in your schedule. And you can't tell them I'm unhappy. You got to show them that you're unhappy. The way you do that is you literally sit in the front and watch them make phone calls. It'll be super duper uncomfortable. If you do that once or twice, you're going to find magically those 2 to 3 hour holes in your schedule start disappearing, because the front desk does not want you sitting there with a scowl on your face watching them make phone calls. Super uncomfortable. So now suddenly they're starting to sell treatment. They're starting to book the patients on your schedule. They're starting to pull things out of hygiene. They're starting to make sure, like, oh crap, do not let this doctor have this big hole because he's going to come up here and stare at me and make my life miserable, right? That is perfect. That is exactly the type of thing that you want to have happen when there's a hole in your schedule. You want the front office to be like, oh, shoot, we got to get somebody in here and get somebody in here now because I don't want this doctor up here, scowling and staring over my shoulder. All right. Second thing on this is it's almost kind of funny. When you got a 3 hour hole in your schedule, doctor's sitting in the back on his or her cell phone, And then when everybody's like happy. And then when it's busy, right? The doctor comes up and yells at the front office, it's busy, like there's too many patients, there's this, there's this. Think about what we're doing to the mind of the front office. When it's busy, the doctor is up here, he's yelling at me, he's really mad. And when it's empty, there's silence. He's happily sitting in the back on his cell phone. I get to just relax up here in the front. Just think about the type of training that we're giving to our front office staff when we do that. It's the exact opposite of what we actually want, which is, hey, let's stay busy, right? Get some patients in here. I do not want to be sitting on my ass for 3 hours, not making any money and not helping any patients. I want to be busy. So what I recommend to doctors is when it's super busy, your blood pressure should be up, but hey, you know what? That's the time when you need to be like, hey team, this is great. Hey team, let me buy you lunch today. Hey team, these are your happy times. And when it's really slow and you have this hole in your schedule, that's when it should be the uncomfortable time. That's when I want you to have a kind of a scowl. Okay, let's start making some phone calls. Let's fill the schedule. I'm going to just literally sit here for the next 3 hours. If you don't get anybody on the phone, instead of sitting in that office in the back, I'm going to sit right here and watch you make phone calls. Literally that uncomfortable. And when you do that, again, you're going to see magic. It'll just magically occur that those big holes in your schedule will start disappearing and you'll start getting a busier and busier schedule. Awesome. Thank you guys. Appreciate it.